I believe that my personal connection to harm reduction is that when I was in like my chaotic use, I never had anyone like teach me anything or like try to like show me ways to like keep myself safe. I contracted Hep C while I was using, and like when they diagnosed me at the doctor's office, I was like, what's that? Like, I never even heard of it before. I had no idea like what it was. I didn't know you could get HIV or Hep C through sharing syringes. Like, I just basically was like really like, I don't know, like green or ignorant to like a lot of things. And I think that a lot of times we take for granted what people know. Like, we think that just because we know something that someone else knows it. And so I think that like what is done for me is like I love like being able to like go out and like, you know, have a conversation with someone and build relationships and like, you know, just like tell somebody something that like they didn't know, you know. Okay, so I definitely felt like there was a need for a program like this in Austin, because although we did have an exchange program, we did not have a mobile exchange program. And with doing outreach with another program I worked with individuals who are living with HIV, I found the need for, number one, people who are camping kind of like in isolated areas that were hard to reach or that couldn't be reached by van. For people who couldn't make it to the van, who may be like not well enough to make it to the van, or unable to like, you know, lack of transportation, lack of being mobile. So I definitely saw that there was, you know, a need for us to go to the people and not expect people to like necessarily come to us, especially if there's barriers to them coming. So I remember when I first started doing outreach, me and my partner that did outreach together all the time, we were just out there like, I don't know, it felt like 24/7. Like, they had to make us go home. We were over so many hours. Like, we just wanted to like run the streets constantly and be doing outreach and be talking to people. And like, we just like built some really good relationships, you know. And I just remember like I needed that at one point. Like, I totally needed clean rigs because I'd go into Walgreens and like they wouldn't sell me any because I wasn't diabetic, or you know, the guy down the street that sold rigs for $1, like I had 99 cents and he like wouldn't sell me a rig. He was like, go get a penny. And like that was like the one day that I couldn't find any change on the ground. And you know, just like I just in general needed somebody to like talk to sometimes, and like, you know, to feel like somebody was like interested in me for, you know, something more than like what they could get from me. So yeah, I think that's what I really like love the most about the program, and why I think that we need it, and why I wish that I had that when I was out running the streets, you know. Not to mention like, you know, just having access to supplies, like, you know, that could prevent me from contracting like HIV, Hep C, you know, like wound care and all that kind of stuff, you know. So showing me like how to hit a vein and like not, you know, destroy my skin and, you know, have abscesses everywhere. The ability to pay employees, period, you know, and to like, you know, be able to I mean, of course, like, we're just passionate about doing it, and we love doing it, and we do it whether we're getting paid or not. But it's nice to get compensated, you know? People need to be paid for the work they do. And it's just, you know, it's given me and other people an opportunity to, you know, have meaningful work. You know, one thing that I hate about society is that, you know, we judge people that are using substances, and, you know, we want them to be productive members of society, but we make it almost impossible for them to, like, make a living or have a job. So one of the things I love the most about what it's done is I decided that I was going to employ only people who were actively using substances, because I wanted to show that, like, hey, you know, just because people are using doesn't mean that they can't, like, hold a job and, like, you know, be, like, productive and, like, help other people, and that, like, people that use substances, like, aren't these, like, horrible, like, bad people. So that's been, like, a really important thing for me. There's a lot of things I'd like to do with Texas Drug User Health Alliance expansion wise. You know, as far as, like, education, one thing that me and one of my coworkers has spoken about is, you know, the way that people are treated when they go to receive medical care. You know, people, like, they don't want to go to the hospital because for fear of being, like, shamed and, like, treated poorly and, like, being turned away. You know, like, you pretty much have to be, like, almost dying, you know, before you'll go in. You know, a lot of people, I remember one time I had an abscess and I went in to get it taken care of because it was, like, really, really bad and painful. And the doctor that lanced it for me said that don't give her any pain medicine. She needs to feel this because she did it to herself. So, you know, just experiences like that. We'd like to get into, like, educating healthcare providers on, like, you know, sensitivity and, like, how to treat people who use substances, and kind of give them, like, I don't think there's enough training in the medical field with substance use. So, like, it'd be great to be able to go in and, like, do that. Also, it'd be great to expand to have, like, a mobile unit, maybe even, like, a brick and mortar location where people could, like, drop in and, like, talk to somebody, receive services, just pretty much, like, maybe a clinic in there that has MAT, no, a 24-hour methadone clinic, no. I could, like, go on and on, but yeah, so lots of ideas.